once the visit starts, and Jeff and maybe Vivian as well, so patients can expect that they're going to go through the non-invasive markers that we mentioned, ask a lot of questions, try to deduce symptoms. Is there anything else they need to know about what happens once the visit starts?
I think once you get connected, it's very much, like a typical health encounter, understanding that we might not be weighing you as we normally would or do a physical exam, which isn't always necessary. But I think a very important aspect of the meeting is that the conclusion part. You don't have necessarily a receptionist to actually figure out and help conclude your meeting and plan the next step. So it's really important to really establish with your physician who's going to make the next contact regarding when your next appointment is. If there are procedures that have to be booked, who's going to do that? Do you actually reach out to the admin or clerk, or will they reach out to you? And every physician might be a bit different. So just make sure that you have the right contact information that you need, and make it clear who's contacting who. And I always make it very clear to my patients, I will be faxing your prescription to this particular pharmacy. Try to get maybe that information. The patient should, you should try to get your pharmacy information. That's another important thing. If we don't have that on file already, it's very helpful if you know your pharmacist's fax number so that we can expedite getting those prescriptions to you, those kind of things.
Yeah, and also, sorry. I also wanted to echo that similar to what Jeff said, is like to be very clear. So if you don't understand what the action plan is, before hanging up or before like ending the video visit, make sure, like as a patient, that you voice, like, I'm not sure, like, what is my next step? Like, what did you want me to do? Because it is sometimes hard when you're talking on the phone and you may not be able to see, what the facial reaction is. That's why I kind of like video visits a little bit better with patients, and I can see, like, do they understand what I'm trying to explain or what the next steps are.
And they can see you, so there's not as much risk of misunderstanding, right? Sometimes we say things and you need that facial contact. You need that to see the person in order to completely get the point.